Okay, great. So it's very exciting to help moderate this final panel. You know, I was listening in on all of the presentations. I have to tell you, I'm blown away and wowed by and honored to be with these three speakers on this. I mean, so many cool things that each of you talked about. Dr. Lustig, you know, really giving us that amazing overview of really, I think, sort of the etiology, the pathophysiology of the epidemic, the pandemic of metabolic disease, and then our targets for action. You know, Mr. Wolfram, what a cool example of industry stepping up and being innovative and taking leadership. We wish, you know, I'm an infectious disease doctor. I wish that we could infect all industry with that kind of philosophy. And Mr. Voss, wow, I want my leaders from the GW health systems to come visit you. What a wonderful set of examples. For this panel, we've got about 50 plus minutes. Yeah, you know, there's about 50 questions that you folks have already submitted. We're going to do our best to tee up questions, as many questions as we can, and also be watching the Q&A and the chat for new questions. What I'd like to do to start, though, could each one of our speakers, Dr. Lustig, Mr. Wolfram, Mr. Voss, could you give us a one-sentence sort of, like we talked about yesterday when we were prepping for this? You know, when we turn all this off and we, you know, go off and do our thing tonight, what do you want each of us to know? What's the one-sentence take-home that you want us to do as, you know, participants in this meeting, either healthcare providers, health systems people, public health people? What's that one-sentence thing that you want us to take away from your part of this today? Start with you, Dr. Lustig.
First of all, thank you, Buffer. What I want people to know is it's not what's in the food, it's what's been done to the food that matters. Food processing is way more important than what the nutrient content is. But the problem is they don't tell you what's been done to the food on the food label. The food label is essentially useless, and it's been proven to be useless over the course of the last 30 years that it's been in existence, and it's not going to get any better. My goal is to kill the calorie. Okay, if the calorie survives, I have not done my job. People have to understand that calories have nothing to do with what's healthy. The two things that determine whether any given food is healthy are two precepts: protect the liver, feed the gut. Any food that does both is healthy. Any food that does neither is poison, and any food that does one or the other but not both is somewhere in the middle. And that's how you have to look at any given food and any given diet plan for any given patient.
Cool, thank you. Wolfram, your one sentence takeaway.
Well, I'd love it for everyone to sort of become familiar with the idea of what metabolic health is from a scientific standpoint. But really, you know, I think Rob talked about, you know, who you want to dance with, and you said, you know, how do we infect? Essentially, I want us all to join the Metabolic Alliance. It hasn't been necessarily formally established yet, but there's a number of us emerging around that. So please, you know, reach out to me and my colleagues after this, because there really is we're at a tipping point, and this really is a movement. I know that's a long sentence, but there it is.
No, thank you, thank you. And Kevin, your one sentence takeaway.
Sure. I said a lot in my talk around hospitals having a responsibility to lead and leading in creating environments, which I say encourage and support, right? Healthy food choices. And food has great power to bring us together. We've known that. I mean, that's nothing new. So how are you using that power? And whether that's small or large, you know, start. And if you don't know where to start looking at some of the economic factors that are driving large institutional food buying. Be more than willing to talk with any of the attendees listening, and be more than willing to share my contact information. We need to start small or large, and we have a responsibility as health institutions across the country.
Cool. Thank you all for that. Let me get to questions that have been submitted. And again, everybody, please, if you've got new questions, put them in either Q or chat. We'll try and deal with as many questions as we can. Particularly for Dr. Lustig, there's about 5 or 6 or 7 questions about fructose and fresh fruit. So can you talk about how fructose found in fruit can be dealt with differently in the body compared to fructose in ultra-processed foods? So there are about 6 or 8 questions about fruit and fructose, and all of you, but let's start with you, Dr. Lustig.
Diet sweeteners will come up after that too.
Exactly. Go there.
Standard question. All right. The chemical fructose is in fruit. Yes, that's what makes fruit sweet. It's true. And it's the same chemical fructose that is in the added sugar that the food industry uses. It's the exact same molecule. The difference is the fiber. The fiber is the nutrient you don't absorb. The fiber is the nutrient for your bacteria. And basically, the way you need to look at it is when God made the poison, he packaged it with the antidote. Fruit has fiber, and the amount of sugar in any given fruit is correlated with the amount of fiber almost on a diagonal line. The only 2 fruits that don't fit that line are grapes and bananas. They have more sugar than fiber. Everything else, the amount of sugar is equal to the amount of fiber. Example, sugar cane. It's a stick, okay? You can't even chew the damn thing, all right? More sugar means more fiber. The fiber acts as an inhibitor of absorption. And so if you don't absorb it early on in the intestine, that means you're protecting your liver. And it also means that it's moving further down the intestine where the bacteria will chew it up for its purposes instead of yours. So if you can get that fructose past the duodenum into the jejunum, past the ligament of Treitz, basically that fructose wasn't for you. It was for your bacteria. So even though you consumed it, you didn't get it. And so fruit, because of its inherent fiber, is safe and fine. The problem is when you put it in a Vitamix.
Anybody else want to comment on that, Wolfram or Kevin?
Well, I'll take a shot. I have an amazing lemon tree out in front of my house. It just I have enough lemons to feed the entire block, and I often do. I've been recently working on a recipe for a healthy ice cream, if such a thing can exist. And I came up with a really fabulous recipe, thanks to something Dr. Lustig said, that just a little bit of fructose could add the flavor, the pop, maybe the hedonic pop that I needed to make the ice cream good. And it's only like 2 grams of fructose from the fruit, plus I put in some zest. But it's really, an example how you can still work with the substance and combine it with other healthy ingredients and come up with a healthy food. We're not trying to vilify fructose, in a vacuum. It's all about the context.
Right.
Yeah. Terrific. Well, let's move on. And let me go to the other end of the spectrum here. Kevin, there's a whole lot of questions in the Q&A and in the chat about how Spectrum did what Spectrum did. And could you take a couple minutes and tell you the story of how you got there, particularly, who started the discussion, who led it, how did you get funding, how did you create momentum, how did you get the partners? I know there was quite a bit in your presentation, but people are fascinated. And I think back to where Tim Harlan started us, we all come from different perspectives, and many of us relate to health systems. And so maybe keep giving us clues how each of us in our own disparate health systems might begin to move the needle in each one of those.
Yeah, I saw that question, and it's a large question. It's a little intimidating, but I will say 6 years ago we started a journey. I mean, it was more than 6 years ago, but there was an initiative 6 or 7 years ago around what our wellness strategy should be at Spectrum Health. And I mean, as I suspect most health systems across the country, whether it was 6 or 7 years ago or 8 or 9 years ago. And our chief medical officer was the executive champion of that, and that structure we use to drive our strategies. So one message is this came from the top, and that was very helpful in knowing that if we were going to make a change to create a culinary medicine program, it was going to have buy-in from graduate medical education, as well as all section and division chiefs, because our chief medical officer was driving it. Or that doesn't always guarantee that that follows, but it is influential. The other ideas is we just happened to be doing a large renovation. So I've been in our organization for 10 years. I've been in my system leadership role for 4 years of that. The previous system leader started the large scale renovation of the main medical center. She retired in the middle of it, and it gave me an opportunity to look at what she had planned. And she had a very interesting, good plan, but it wasn't going to challenge us enough, especially with the momentum we were getting with our chief medical officer driving what should wellness look like at Spectrum Health. So we scrapped the plan, and I had guardrails to stay within this budget, but the X millions of dollars to renovate the cafeteria was already in flight. I just had to repurpose those dollars to make it impactful. So I think that's a really important thing. Dr. Christy Arts and Dr. Leanne Moriello. So Dr. Christy Arts is emergency medicine physician that has clearly a passion in culinary medicine and lifestyle medicine, who is now our medical director, was a great influencer. So for any of you wondering, I read a lot of the chat, how does my cafeteria make a change? I will say having a medical director. So it's fascinating. Many nutrition services departments around our nation don't have a medical director overseeing what's done in that nutrition. I mean, some of them in TPN management have some medical director oversight. But in what we're doing what we're serving a patient or in our cafeterias, we don't have that. And I think that's an area that actually my story hopefully can promote, because that medical director role in Dr. Arts's voice was really, really impactful. And then lastly, I'll say, we took a lot of someone put in the chat, we took a lot of the science around marketing and promotion and placement and pricing. I mean, the 4 Ps of marketing that you learn in any MBA program. And we dug into as much literature as we could. And that really, really helped drive the change as well. And to be honest, we were more focused on putting delicious food in the right place than the science behind it, although the science helped guide us. And I think we, it worked out. So leadership from the top, a medical director helping and partnering in atypical areas of health system. And then I think there is an aspect of talking about the economics of food service in a health system that is often not a subject that people want to talk about. I mean, Dr. Lustig, I'm curious in your elimination of soda, how you partnered with the nutrition services director, and if that was challenging, or if you have any stories.
Challenging. Oh my God, we had to practically kidnap her. Basically, it wasn't because of me. It was because of us. There's an entire group of people at UCSF who initiated this. I was only one of many. We actually have our own little name for ourselves. We call ourselves the Sugar Hill Gang. And there are about 7 or 8 of us. Alyssa Eppel, Laura Schmidt, Ashley Mason, Claire Brindis. These are big top flight public health professionals. Stan Glantz, Mr. Anti-Tobacco, Dean Schillinger. This is a firepower group, and we all recognized the toxicity of sugar and recognized the problem, and said that basically hospitals needed to model good behavior for patients, and we needed to do this. So I wouldn't say that we were, shall we say, handcuffed. On the other hand, the dietitians at UCSF put up an enormous stink initially. And to be honest with you, they're actually still putting up a stink even today. They thought that this was cruel and inhuman punishment for the patient to not be able to have a soda on their tray, their dinner tray. What were the visitors going to say when they got to the cafeteria and there was no Coca-Cola in the cooler? This is terrible, et cetera, et cetera. Ultimately, health won out, and the dietitians basically said, all right, we'll try this and we'll do it for a year, but we won't take out juice. We refuse to yield on juice. So there is still juice in the cafeteria, to my horror and dismay. So it's baby steps. At Swedish Hospital in Seattle, they've actually taken juice out of the cafeteria also. So they're actually ahead of us, good to their credit. And Uma Pisharodi, a colleague of Wolfram's and mine, has led that charge. Bottom line, nothing succeeds like success. There were 2 things that we had to show. One was that, in fact, sales continued, and they did. In fact, they didn't miss a beat. There was no drop off in sales of beverages, and we logged that. And the other was, improvement in employee health, which we were able to do. Obviously, we can't, improve visitor health. They're visitors, but we were able to follow 214 of our employees who were high sugar consumers, and showed that in the reduction in availability on campus, predicted improvements in both waist circumference and insulin sensitivity. Didn't change weight, mind you, but it changed waist circumference, which is the visceral fat, the metabolically active fat. So, the dietitians have, shall we say, been slowly, but, nonetheless steadily coming on board, at least at UCSF. The problem, of course, is that most dietitians still believe in calories. And that's why I had to write the book Metabolical, is basically to call out the dietitians who don't know the science, who just work with the math, and to tell them that, science has passed them by.
Mm-hmm. Well, thank you all for that. Let me shift a little bit. Wolfram, there's about 5 questions that came in during your talk, and since tell us a little bit more about KDD, and why did that company move in this direction? And are there other companies that are following KDD's lead? And how, the big question is, how do we get stakeholders and corporations to see that bigger picture and begin to change their corporate culture?
Well, KDD is a family-owned business with over 50 years in Kuwait. And this also came from the top. The CEO of the company was inspired by Dr. Lustig's work. And I've been in other rooms with CEOs with Rob. And so, most of those conversations have been very private. And those CEOs of companies are very interested in hearing what people like Rob have to say, but they haven't really taken the science and the information into really making change within their companies. This is one remarkable example. Katie, we're just at the beginning of our journey, and we've put a lot of investment on the front end, not just rushing into the kitchen and coming up with new recipes and pulling the sugar out, et cetera, but really laying a whole framework as the basis for the initiative. But also the framework included engaging, as Kevin's spoken about, is really you have to have buy-in from all the leadership, marketing, sales, product development, all of the key leaders within the company have to be on board. There has to be what I called a commission in my presentation, where it's not just the CEO saying, everybody do this, but really getting buy-in. And then we've had a lot of discussions to convey the science. We have monthly meetings with this team of doctors and scientists we put together to really convey the science to the team. Because just a lot of this science is not out there, and that's really a critical piece. The other piece that's really remarkable is that the leadership at KDE chose to make this both public and private right from the beginning. So, we're still very early. We've just laid the foundation for how we're going to really re-engineer foods. But we've been engaged with organizations like the World Economic Forum and the World Business Council for Sustainable Development, which include the biggest food and beverage companies on earth, to engage them, because we know that a Lone Ranger company, one company can't do this. It takes, all ships rise to the tide, but also all ships sink with the tide too. So, both Dannon and Nestle have implemented initiatives to reduce sugar across their portfolio and only gotten to 14%. We know we have to reduce that threshold by at least 50%, in Kuwait 60% if we look at their current consumption. So it's not just the internal stakeholders, but also trying to pull in some of the external stakeholders as well, because we exist within an ecosystem. And I think that kind of thinking has been baked in from the beginning, which makes it much more stronger.
Please go ahead. Yeah.
All right. The food industry knows. They know. I know they know because they've told me they know. The problem, of course, is the business model is such that, they can't, extricate themselves from their profits. These are one of the reasons KDD is able to do this is because it's a privately held company. One of the reasons Mars was able to endorse the WHO guidelines for 10% of added sugars is because it's a privately held company. They can take the long view. Okay, those that have quarterly, Wall Street reports and business earnings, and it's all about the profits. They can't do that. I was part of a private meeting now 10 years ago with a company which will remain nameless, 10 scientists, 10 corporate executives. And they told us straight out, we can change. We had to change before when we went low fat. We can change again with two provisos. We won't go it alone, and we can't lose money. The two provisos. Well, unfortunately, given our current food business model, both of those are non-starters. So how do you not go it alone? Well, we have, KDD as an example of how you can start. Everyone wants to be second. No one ever wants to be first. I found that out. But the fact is, we're forging a trail, and there's a template. There's a playbook. The metabolic matrix is the playbook on how one does this. We can't lose money. Well, the reason they can't lose money is because right now all the foods are using ingredients that are subsidized. So the question is, why are corn, wheat, soy, sugar subsidized? This is a holdover from the original Farm Bill. There's no point to it whatsoever. There's no economist on the planet that believes in food subsidies because they distort the market. Even libertarians should be on board with this. because, you know, why is government, you know, propping up certain foods and not others? You know, let the market work. So the question is, would the price of food change if we got rid of all food subsidies? And the answer is no. The Giannini Foundation at UC Berkeley actually did this exercise in 2007, where they modeled what would the price of food look like if all food subsidies, all of them, had, you know, all of a sudden, you know, disappeared with a magic wand. And the answer is only 2 items would go up in price: corn and sugar. And those are the ones we want to go up because that would reduce effective availability. So it wouldn't even actually change the price of food, but it would make the food healthier. And it would allow the companies actually to extricate themselves from their own straitjacket of, you know, being tied to, you know, subsidy use in terms of making these foods that ultimately are ultra processed and, you know, poisonous for us.
Mm-hmm. And from my lens, one, I love being on a panel with both of you. So thank you for that. But if we go down this where this conversation started, how can KDD do this privately held, right? And Dr. Lustig, your point, I do want to bring up that we are a self-operated nutrition services department in our organization. So when you're asking yourself, how can we start? One of the first questions should be, is your food service in your health system self-operated or contracted? Because I will say many of the contracted companies are publicly held. And if you want to take away the #1 most profitable item from a publicly held company, there's going to be at least tension in they're making their profits for their stakeholders and potentially what your health system knows is best. So hopefully that's helpful to this conversation.
No, it's similar to
and go further down that path. Did you face that in your health system? Or you inherited a system that was internally, your food service was internally owned?
The majority of over the last 10 years, there has been smaller critical care access hospitals that we have merged and acquired that were contractual food service and environmental services that we have done adequate due diligence to make the argument that a self-operated food service essentially invests in the mission and vision of the health system better than a contract food service. So I think Dr. Lustig, you were going to chime in, or?
Say it's similar to the pouring contract story on university campuses. You know, basically they're, you know, you're all straitjacketed, you know, when you're in bed with them.
Yeah, and there was a couple of questions about that in the Q&A. So thank you both for addressing that. There are, let me, again, I know I'm bouncing around a little bit, but I'm trying to get to different people's questions. There was 4 or 5 questions about non-caloric sweeteners. What kind of research is being done to evaluate their effects? Thoughts about sugar-free products that use sugar substitutes, the role of xylitol.
Right.
Yeah, let's go there.
All right, Wolfram, go ahead.
All right, I'm holding up what looks like sugar, but is actually allulose. And allulose is the new favorite kid on the block in the non-caloric sweetener category. It exists as a natural sugar in nature, can be found in nature in raisins and dates and things like that. But this is actually made from corn, from a complex process, but they actually are working on a single-step enzymatic process to make the substance. What makes it stand out from the rest of the non-caloric sweeteners is it appears to have some metabolic benefits. I can tell you I'm type 2 diabetic. I wear a CGM. I look at every single food, every substance that I consume. What's remarkable is that my blood sugar goes down after using an ingredient with this recipe, and that it stays stable for hours at a time. So that has really impressed me. Now, is it a panacea? Are there other possible areas where it's triggering the endocrine system with the wrong messages? I'll leave it up to Dr. Lustig and some of the sugar scientists that have been weighing in on this. I think the jury's still out, but I'll let Rob make a comment about that in general.
So the whole question of non-caloric sweeteners is very complicated, but let me try to make it simple, as simple as I can. The paper came out in the European Journal of Clinical Nutrition back in 2019 that it basically said the toxicity of one Coca-Cola equals the toxicity of 2 Diet Coca-Colas. So half as bad. That doesn't make it good, just means half as bad. All right. Now, you say, wait a second. How can that be? 0 calories, 0 fructose. How can it be, half as bad? Why isn't it not bad at all? And there are several possible reasons, and we're still working on the research, but it's looking more and more like this is the case. It still triggers an insulin response. Even though it doesn't trigger a glucose response, it still triggers an insulin response. And the reason is because you put something sweet on the tongue, message goes tongue to brain, sugar's coming, message goes brain to pancreas, sugar's coming, release the insulin anyway. Now, it's not quite as much insulin, it's about half as much insulin, and that's why it's probably half as bad. Because it's the insulin response that matters the most, not the glucose response. People think it's the blood sugar excursion. They're running around wearing continuous glucose monitors. Now, I'm not saying that that's bad, but that's only part of the story. The insulin response is a much bigger story, and the problem is those diet sweeteners still trigger an insulin response. In addition, there's data that shows that at least one diet sweetener, which I won't name specifically, but if you want, you can go look it up, can cause leaky gut and glucose intolerance on the basis of systemic inflammation because it has effects on the gut microbiome. And another diet sweetener, which also will remain nameless for the moment, if it enters your bloodstream, it turns out there are receptors on fat cells, and that the diet sweetener basically can act like insulin by activating those receptors on the surface of the fat cell and drive energy storage in those fat cells, as well as oxidative stress. So if that's the case, then when you absorb those sweeteners, and you're not supposed to absorb them, but if you have leaky gut, you're going to absorb them, you can still do damage, even though it's 0 calories and 0 fructose. So in general, diet sweeteners are probably not a great answer for our sugar addiction. Now, having said that, Wolfram just told you about allulose. Allulose is an isomer of fructose at the 3 position instead of a alpha hydroxyl group. It's a beta hydroxyl group. It has a completely different metabolic profile, seems to actually lower LDL as opposed to raising it, seems to have a very, very minimal effect on insulin compared to some of the other diet sweeteners. Is allulose the answer to our, our needs and our wishes and our desires and our hopes and our aspirations? I don't know. We don't have the data yet. Okay. But what I do know is that we need to de-sweeten our lives. Okay. But we need help doing it. And anything that can help us get there is a good idea. And allulose may be one of the, it's like methadone. Okay. It's not good, but it's a hell of a lot better than heroin. Okay. And it may be a method for weaning our entire population off high intensity sweeteners.
Just a note, I noticed in the chat, somebody brought up hint water. I think they're worthy of note as a product because Carol Golden, the founder, specifically is working on de-sweetening the palate in beverages. There are no sweeteners, caloric or otherwise, in her product. She uses fruit essence and oils and things like that, but no sweetener, no sugar. And so that's I think a fairly unique product offering, and where she's specifically shunning all forms of sweeteners as well as sugars.
Yeah, somebody else in the question Q&A asked about naltrexone. And, has anybody, I mean, it's not a novel idea to me. What do you guys think?
I got it.
Go ahead.
We actually use naltrexone as a probe for sugar addiction. My colleague Ashley Mason at UCSF has a bunch of papers, which I'm on also, where we have given naltrexone in a double-blind placebo-controlled fashion to postmenopausal women with metabolic syndrome to determine their degree of sugar addiction. And their cortisol rise and their nausea scores basically tell us whether or not their opioids are being interfered with by the naltrexone. So we know about this quite well. There is some data in the literature on using naltrexone as a method for trying to deal with food addiction, and specifically sugar addiction. It's got some side effects. It's very expensive. It is not covered by insurance. It is, $50 a pop. It is, not for the squeamish. It may have some effects. It does not work in binge eating disorder. It does not work in MC4R, melanocortin 4 receptor mutation patients. So it has, I think it has limited utility, but what it does is it demonstrates that this concept of sugar addiction is very real and that we have to deal with it as a society. Okay, we're all addicted. Okay, and guess how we got addicted? Food industry did it. Because they put the sugar in the food that wasn't supposed to have sugar on purpose, because they knew when they add it, you buy more. This is addiction.
Well, and
on a grand
and the parallels between the food industry's history here and science and policy and politics, the parallels between this and tobacco, of course, we're all learning more and more about. It's very, very scary. But let me. There's a question here which is almost a bigger philosophical, cultural question that I think it would be really interesting to hear all of you respond to. One person asked, how do we balance the need to retrain the cultural palate and brain to appreciate lower sugar foods versus just replacing them with non-caloric sweeteners?
Well, I think one approach is that's clearly worked in some cases is if we, let's just say as a society, as a nation, we agreed that the WHO standard was a guideline that we wanted everybody to reach, and so we basically passed a law saying, making it possible that all companies compete on the even playing field and are required to meet that target. Now, there has been like an example in the UK where industry, NGOs, and government got together in sort of in a back room, and they did this with salt, and it appears to have worked. They didn't make an announcement about it. They didn't go on an education campaign. They didn't engage the general public. They just went in the back room and did it and implemented it, and it seems to have worked. The point is that when you get the key pillars of society together and you agree on a target and everybody plays by the same rules, you can make a change. Now, that's easier said than done, especially in our society, which seems so polarized and so challenging to reach across the aisle, as they say, and get, to work with people you think are your enemies or on the other side.
So what I would say in response to that is, during my talk, I had those 5 proposals that I mentioned. The last proposal number 5 was get fructose off the GRAS list, the generally recognized as safe list. If you did that, then fructose would go from being a food to being a food additive. Now, there are 2 items that have been removed from the GRAS list once they've been put on. Okay, nitrates and trans fats, because we recognize that neither of those were safe. Okay, and it took 25 years in both cases to be able to do that, but they did come off. So if we could get fructose re-evaluated by the FDA, the last time sugar was evaluated was 1986. And what came out of that was the data was, quote, inconclusive. but the problem was the mean consumption at the time for sugar was 51 grams. It's now 94 grams. So we've practically doubled the amount that we've consumed since 1986. If we could have that reevaluated and get fructose thrown off the GRAS list, then that would turn sugar from being food to food additive. And that would then give government and, NIH and CDC and, potentially even BATF opportunities to be able to, regulate how much is too much, so we could actually like get a lot of the foods that currently are spiked with sugar, like salad dressing, out, so that people, don't know, that they can reduce their consumption and not even know it. And, we can sort of get back to something that resembles a state of normalcy. The other possibility is differentially subsidize. That is, tax the foods that have sugar and use the money from the tax to subsidize real food that doesn't have sugar in an attempt to try to bring it to lower socioeconomic status people, so that, we deal with the, social justice issue of this, which I'm totally for, because the people who are the most affected are the people who can afford it the least.
So let me make a comment here. Again, this pulls a little bit from my experience, when I was at FDA setting up the Tobacco Center. But one of the things that I think a lot of clinicians do not realize, a lot of us in the public sector and clinicians particularly do not realize, there is this whole regulatory process that FDA goes through for public notice and comment for proposed regulations. And we clinicians and people that work in health systems, in hospitals and industry should be knowing, when our comments are needed, and there should, so what are the organizations that can help me as a practicing clinician and a public health guy know when there's a regulation being proposed at FDA that I should be commenting on, and what the different perspectives are. Because again, one of the frustrations I had as a regulator, very rarely do the frontline medicine or healthcare systems or experts actually really comment and give FDA that perspective. Industry does a lot, and the people that are financially involved. So those are real actions that we as individuals can and should take to be involved in the regulatory process. Can any of you talk about ways that we can begin to get the community involved in understanding when they should respond to proposed regulations and give their comments?
Well, I can speak up because I've been a food system advocate for the last 4 decades, and there's just no easy answers to how you get people engaged and vote and participate in the democracy, etc. I mean, I have the same tired old examples that I've been working on my whole career. Education, we really have to insert these narratives into educational systems. When the food guidelines, the current dietary guidelines were passed, I think it was 1980. If you look at the act of Congress that was used to pass it, they actually commissioned, the Congress said, do this, but also conduct a study trying to figure out why medical institutions in the United States do not teach nutrition. Only at that time, 30% of medical institutions taught at least one course in nutrition at their school. Today, I think it's 29%, 4 decades later. So we've actually gone backwards, not forward. I mean, this group, Culinary Medicine Group, of course, is a wonderful anomaly, but we have a lot of work to do, not just educating the general public, but our doctors as well. Right. How to get people to participate in the democracy and vote and so on. That's the best answer I have is, we just have to do a better job at educating and getting to the influencers like doctors.
Well, that's why metabolical is basically, I wrote it to be a medical textbook. There are 1,054 references, and I very specifically need doctors to read that so that they understand what it is that they're doing, because they don't know. And it's true, 28% of medical schools have a nutrition curriculum, and those that do, the amount of contact time is only 19.6 hours out of a 2,000 hour medical curriculum. So it's ridiculous. I mean, and doctors don't know anything about nutrition, and I know they don't know anything about nutrition because I was one of them. I know that. The fact is that it never entered medical parlance, and the reason goes all the way back to the Flexner Report in 1910. Nutrition was not embraced, and there were lots of reasons, including the fact that John D. Rockefeller, who basically sponsored the Flexner Report, had a lot of coal tar to sell, and he was interested in pharmaceuticals. He was not interested in nutrition. And so the bottom line is, we in medicine have a long history of ignoring, nutrition for favoring the pill. And there is no pill for this, because the 8 subcellular pathologies that belie chronic disease, and I'll name them real quick: glycation, oxidative stress, mitochondrial dysfunction, insulin resistance, membrane instability, inflammation, methylation, and autophagy, are not druggable. There's no medicine for any of those 8. They're foodable. Okay? And the problem is, they're also poisonable by food. They're both. They're foodable and they're poisonable by food, the wrong food. And that food is called processed food. The question is processed food food? And actually, if it's poisoning your mitochondria, I can't call it food, can I? I don't think you can call it food. And that's part of what we have to re-educate doctors about, and what we have to re-educate the public about. The problem is that education has never solved any substance of abuse. Did Nancy Reagan's just say no work? We got an opioid crisis.
All right.
Yeah, I think supporting Robert's point, I'm amazed at. I mean, we've had over 100 residents and fellows through our program. I'm amazed at when I stand in the teaching kitchen and they understand what good whole grain, non-added sugar food, processed food tastes like, and I'm amazed at the lack of education that they speak of to date that they've. So I think it is. We all know this on the call, but the culinary medicine movement has a great opportunity to do some educating, and I'm excited to see where that's going to go.
Well, and Kevin, I think, and just Wolfram, just like Kevin, I think your observation is really important. The aha moments that I've seen medical students have as they go through culinary medicine training, and particularly as they're delivering that to their patients, it's so empowering that again, I think it's why we're all here at this meeting and call. Wolfram, I'm sorry I interrupted you.
Yeah, I've been working my whole life for education and fighting for proper government regulation in the food industry. But one reason that I co-founded a food data technology company was so that rather than wait for when we actually pass the legislation we need to do 10 years from now or 5 years from now, we can put technology tools into consumers' hands to make powerful decisions right now. For example, we say reduce added sugar. You want to tell, we point to consumers, well, they just don't have to eat the sugar. Well, with 262 names for added sugar in the food supply and probably nearly 600 names for sugar that actually exist, how can we possibly expect consumers to make the right decision when 75% of all products on the shelf have added sugar? So we've created a filter, a no added sugar filter, which makes it possible to only see the products that don't have added sugar. So you only see 25% now of the products that are on the shelf, which are basically whole food products, because added sugar is a marker for processed foods and especially for ultra processed foods. the consumer can use that tool today and make a decision. They don't have to wait until medical schools start teaching nutrition and the USDA and the FDA and so on pass new regulations. So that's another front where we might be able to, I don't want to say we don't need education and we don't need government regulation. We need that. But in the meantime, we need tools in people's hands today. And that's what we're trying to do with Perfect.
You know, there's been two questions that have just come into the Q&A or the chat that I want to ask all of you about. You know, are there different policies in different countries? Such as Mediterranean countries where sugar isn't such a big deal. Why is it so hard for us to do it? And are there lessons to be learned elsewhere in different nations or different cultures that we might learn from?
They're all doing better than us, but they all have a lower added sugar content to their diet than we do, in part because sugar is more expensive in those other countries. It's not a primary diet staple like it is here, and they're not, all, big ultra processed food fans. However, those that are have the exact same problem we do. So the US spends 7% of GDP on food. The UK spends 9% of GDP on food, and Australia spends 11% of GDP on food. We are the three most obese diabetic nations. So, ultimately, it's our cheap food that's killing us. Now, other countries have problems where they spend 36% of their GDP on food. And all of those are in revolution, in the last 10 years. So there's a balance to be, struck here between, the price of food and, and its healthfulness and also societal stability. There are countries that do better than we do. Without question. Can we learn from them? No, we can't, because we have food subsidies.
Yeah. All right. We only have about 4 minutes left. Let me, I started this with asking each of you for sort of that one sentence takeaway of your thesis. Let me close with asking a similar question. I'm going to click off in a couple of minutes. What's the one thing you want me to do? And everybody else that's listening, the one thing that each of you, from your perspective, to move this needle, and it's a multifactorial needle. It's, it's what we're teaching. It's what we know scientifically. It's what industry does. It's, how industry can lead. It's how health systems can lead. So, but each of you, is there one thing that you want to challenge each of us to do? From this presentation and panel?
You guys, I can go first. I'm gonna add on to the question of how did Spectrum make the change that they made? Because this is the better story. When we changed the cafeteria and opened it up, our president and CEO toured with our board that space. It was myself, Dr. Arts, Dr. Leanne Moriello, and our corporate chef that toured them. And I started the tour and said, this is an atypical board tour. Our board meets once a quarter, and usually they try to go to a renovated or new tower that we've built, right? And the medical space. And I said, this is an atypical board tour for you all, but something that we're very proud of at the organization. And Dr. Arts said, I'm going to correct Kevin. This is as much a medical space as any of our OR suites or any other patient care area. So my challenge to all of you answering your question, Bopper, is I want you to go and challenge the senior leadership to tour your cafeteria, whether it's better than Spectrum Health or in great need of change, to be able to understand the medical space that it is and the opportunity you have.
I'll go next and let Rob have the last word. Well, I think one is reaching across the aisle. I mean, I spent much of my career marching around with signs and protesting and urging, companies in the food and beverage industry to change their ways. Dr. Lustig and I have been in the room where we had some private conversations with some of these companies to get them to listen. And we've put ourselves in a lot of situations where it just was not comfortable. We weren't in the room with our friends. What do they say? Something about your friends and stay closer to your enemies. What's the phrase? Anyway,
keep your friends close, keep your enemies closer.
Thank you. So I think that's one key point. Challenge yourself to get out of your comfort zone and work with people, reach across the aisle. I mean, I think that's a message for all of our society today. And the other one, it's the ecosystem, stupid. Metabolic health, metabolic science applies at every level, at the mitochondria level, at the human organism level, and the ecosystem level. And it's all about changing the ecosystem. I'd love to just focus on added sugar and boy, we're done. But there's literally thousands of ingredients in the food supply right now that we should be concerned about. And there's a lot of actors, and it's complex and it's challenging, and this might take a lifetime, but think big, reach out into that ecosystem, be part of the ecosystem, and find ways to participate, and hopefully we can move the dial forward in our lifetime. Rob?
Thank you.
Well, there's so many, I don't even know where to start. So I'm going to go high level. Okay. I'm going to go to a big concept. I'm going to ask the audience a question, a quiz. What's the difference between marketing and propaganda? Everyone, think about that. And I'm going to tell you, marketing is using information to espouse your point of view. Propaganda is using disinformation to espouse your point of view. The difference is the truth. When companies use information to market their products, that's marketing. When they use disinformation to market their products, that's propaganda. Problem is, they've been propagandizing us for the last 50 years, telling us that their food is healthy. The fact is, they don't even know what healthy is. And in fact, the FDA doesn't know what healthy is. And in fact, the USDA doesn't know what healthy is. In fact, the USDA doesn't even have a definition of healthy, because if they did, then no food could actually put on its label that it was healthy. So let's start with the science. We got to start with the science, and the science is now in. And the problem is, the food industry, they don't like that science. So they've done everything they can to pollute the science. They've done everything they can to distract from the science. They've done everything they can to destroy the science. They've done everything to discredit the scientists. The bottom line is, people, are sheep. They believe what they're told. They do what they're told. And it's time that we have to, rethink this paradigm, because we've been propagandized. We need instead to understand the truth. One way you can learn the truth, I think, is if you read Metabolical. I'm not here to promote the book. You'll notice it's not behind me, but the fact is, there's a wealth of nutritional information that is available for public consumption that will help everyone move themselves forward. And if you're a dietitian on this call, on this webinar today, okay, you have to understand that not everything you were taught in dietary school is correct. When I entered medical school 45 years ago, okay, the very first day, the white coat ceremony, one of the most high-level clinicians in the history of medicine told us 50% of what we teach you is wrong. We just don't know which 50%. And what I can say is that the rest of my classmates went to sleep, and I went, holy crap, That means I got to keep my eyes out for the rest of my life, because I don't know when when I'm going to be learning something that's actually not true. And the fact of the matter is, that's why you do research, is to overcome the previous generation's dogma. Bottom line, there is only one dogma, and that is there is no dogma. Everything changes. The thing that has to change right now is the calorie. Kill the calorie. Okay, that is the first step on the way to fixing the problem. Did you hear that, Marion Nessel? Kill the friggin' calorie.
All right, gentlemen, this has been a totally wonderful session. Your presentations were inspiring to me, and I know everybody else. Thank you very much. And everybody in the audience, thank you for your Q&As and your chats. I hope we've answered as many questions as we could. Dr. Harlan, I'll turn it back to you.